we used to run a teaching clinic in China, and so in Beijing and then in Hangzhou, we had set up a practice where people could come and stay with us or train with us. And really it was designed in the early 2000s for people to, we used to teach a lot of programs, and the older doctors that I spent my time with, if a person didn't speak Chinese and hadn't had good classical training, they got a lot out of those programs, but they missed so much because they just didn't understand the classics. So in the 2000s, we set up these hospital programs alongside these training programs with these old doctors. And the object was, can we get a Westerner whose practice, even if it's a busy practice, doesn't see that many patients compared to the East, compared to China? So could we get them through a hospital where in a morning they would see 40 tongues, 30 pulses, have all of these experiences, see these huge illnesses, true black of kidney failure, true green of bile through the skin. I mean, today an acupuncturist looks at a tongue and says, oh, it's a little damp with a little, and they're arguing about little things, whereas the tongues in the books are really serious. If you go to an inpatient in the hospital, you'll see the tongues they were talking about in the book. It is black, it is green, it is yellow, it is bright red, and there's 20 of them this morning. And so we would run people through these hospital programs to get their just vision wider of patients, and then have them train with these older doctors. But as the doctors became older, it became impossible for them to be alongside the doctors. It was annoying for the old doctors. You know, they wanted someone like myself who spoke Chinese, understood, had read the books, could talk to them. So we set up a teaching clinic, but like all things in China, it's just so hard to maintain without bribing this, doing that, that eventually we ended up opening a teaching clinic in the United States, and that was much easier to operate and have people come and go than we could in China. But that was the evolution until it just became too cumbersome in the system. I love China. I thought I was going to live there for my entire life until it just got too complicated with all the visas for our children. We have 3 children and everything else. But it's just too hard to be doing things, and now too expensive. It's much cheaper for us to do everything we do in the United States, and I fly back to China every 2 months, than it is for us to be there and open a clinic.